In this segment of Ethnic Health America, we're going to be talking about good dental care. Our special guest, Dr. Thomas Arnold. Dr. Arnold is a dentist in the Oakland-Berkeley area with a lot of different interests around the health of your teeth. Dr. Arnold, welcome to our program.
Thank you, Dr.
Tell us how you became interested in dentistry.
Well, I'm in the fourth generation of health professionals in my family. My father was a physician. My grandfather was a dentist. I have another grandfather on my other side who also was a physician. And so I just knew nothing but health care growing up.
You know, it's often said that the mouth is the entrance to the body, and that what happens in the mouth can reflect what's going on in the body, and also that good dental care reflects on your health. Do you agree with that?
I definitely agree with that. It's very, very important as far as nutrition, because what happens is that as you eat food, your food have to come together in a certain way in order to masticate or chew the food up properly. The front teeth have sharp edges, and we use our front teeth to actually cut food, and we pass the bolus of food on to our back surfaces of our teeth, and that's when we grind the food up. You know, most people are most concerned in dentistry about their smile, and so we look at the front teeth. But the back teeth are really a lot more important as far as grinding up and chewing food, more important than the front teeth.
You know, a lot of people, even those with good dental insurance, are reluctant to go to the dentist. And it's probably much of it is kind of perception about what it means and aspects of pain. How do you talk to your patients in order to get them to understand that this is a necessary evil, or have we done anything about the pain?
Well, in general, we also know in dentistry that fear of coming to the dentist is one of the main reasons why people don't come. And also finances is another reason. And I think it's very, very important for a dentist to have good chairside manner, just like physicians have good bedside manner. And a lot of that, I think, has been lost over the years because, you know, people respond a different way if you are caring and concerned about their dental health. And this is what I've been doing for years, and it seems to work very, very well for me.
When we talk about good dental care, when you look inside the mouth and you say, what a pity it is these people don't take better care of themselves, what do most people do wrong?
Well, again, I think that they're not educated properly on good oral health as far as flossing and brushing their teeth properly. And that's why that we, again, emphasize how important it is to come see your dentist at least twice a year to get your teeth cleaned by a professional hygienist and also a checkup from your dentist. And then we can go over home care instructions and explain to people, kids from 2.5 years old on up, exactly the best way to keep your teeth clean. Also, some people have their manual dexterity and how they actually handle their toothbrush and dental floss. Some people can handle it from back teeth a lot better than others. And so that's why it's important that they have some good instructions on how to use, let's say, the toothbrush and dental floss in order to keep their teeth clean. Because another thing that happens that we see all the time is periodontal or gum disease, just because they're either so fearful of coming to see the dentist and either they don't have money. So when they do come in, quite a few patients have this periodontal or gum disease, which is inflammation or swelling of the gums, bleeding of the gums. I'm going to stop with bleeding because a lot of people, when they have bleeding of the gums, when they brush or floss, they have a tendency to stay away from those gums. And the gums become even more inflamed because we don't stimulate the gums to make them more resilient and stop the bleeding. So whenever we have bleeding of the gums, we recommend that you work on those areas a little harder so you can keep those gums in good health again.
What can you do in dentistry today that you couldn't do 10 years ago?
Well, again, dentistry has come a long ways in 10 years. And in dental offices nowadays, we call them, some of them are very high-tech dental offices. And we use a lot of computers now, you know, in our particular practice. Running our business is on computers. Now we have digital x-rays where we don't get as much radiation by using these digital x-rays. We can take a picture of a tooth and see it right there in front of you almost in a split second. We can enlarge it, make it smaller, and for a dentist to explain what your oral health or dental problems are, it's a lot easier with this type of procedure. Also, lasers in dentistry, implants in dentistry. I mean, it's just a lot of wonderful things that are going on in dentistry nowadays where we don't have to worry about having dentures and taking teeth in and out anymore with implants. And the system of us placing implants has improved in the last 10 years from A to Z. And I am very, very happy that I can recommend implants to patients now, when 10 years ago I might not recommend it because of the technology has not advanced as much as it is now today.
Now, you are also one of the few, not maybe one of the few, one of the most recognized dentists for your outreach to the community, your Dr. Happy Tooth Foundation. Tell us a little bit about that.
Well, Dr. Happy Tooth was created almost 15 years ago. And again, I was very, very aware of people and their fear. Children and adults are not going to come see the dentist. So I created a character called Dr. Happy Tooth. And Dr. Happy Tooth is a big molar tooth. I made it, constructed it so it looks like an exact molar tooth in your mouth. And it has a nice big smile on it. We have a dental floss and a large toothbrush. And what we did is that we went around to preschools, kindergartens, even high schools and senior citizens. And we had a Dr. Happy Tooth performance. And the reason why that I created Dr. Happy Tooth was to relieve some of the fear and anxiety about coming to see the dentist in a fun, loving way. We developed a Dr. Happy Tooth rap. We have a Dr. Happy Tooth comic book. And it's just been a lot of fun and really great for the community. And I'm very, very happy with that particular project that I've been doing for a number of years.
You know, when we get into these professions, we're always concerned about whether or not we're going to be fulfilled. Has your career as a dentist been fulfilling for you?
Oh, I think it's just been wonderful. I couldn't have asked for a better profession for me to be in. I enjoy working with my hands. I enjoy people. And I enjoy creating from, let's say, a tooth that's not very healthy and making it healthy again and seeing the results. It's been really great.
Dr. Thomas Arnold, thank you for joining us.
And thank you very much.
We appreciate all you've done.
Thank you.